Hey everyone, I'm Alex Nottingham, founder and CEO of All-Star Dental Academy. Welcome to Dental All-Stars. I have Heather Nottingham, co-owner of All-Star Dental Academy and our VP of Training, Phone Skills Instructor. Welcome, Heather.
Thank you. Hi, Alex. Hi, everybody.
Hello. Our topic today is the importance of phone skills. It's important. Yes?
Yes, very
Yes.
important.
It's interesting because I know we talk about this on the side. You're the phone skills instructor, and there's so many exciting issues out there. Case acceptance, which is important, but there's a lot of topics, and they kind of
hmm
grab our attention. Um, in dental space, it's going to be clinical stuff, and there's even things in the practice management space that are attractive to want to talk about. What's amazing is it always comes back to the phones for a
hmm
successful business, successful practice. And I know that you're always reminding us phones are still important and they apply to
Right.
everything that you do, and not
Yeah.
to forget to do that. And what's interesting is all the interviews I do with you, it could be phones or just because they just love you. It's either you or the phones, but they get great
It's a
viewership,
little bit of both.
a little bit of both. So tell me about the importance of phones, because you're talking to a lot of dentists, hundreds of dentists every year. What are you hearing and what's going on? Tell me.
Yeah. I mean, it just, it always goes back to the basics. It's like you were saying, I hear people always want to have that next, what is it, the silver bullet or the shiny new object. It's like, oh, this is really hot topic right now. And there are so many things, like, of course, going out of network with insurance and different things like that, and the newest technology. But it always comes back when I talk to dentists, no matter what, the technology, presenting treatment, if we're not getting patients booked. And I think somebody said, maybe it was Fred Joyle, that said the most expensive or the most important piece of marketing equipment in your practice, or equipment for that matter, is the phone, right? Because you do the marketing, you spend the money, you get people to call to inquire about an appointment. And then what happens from there, right? Like, if we're not successfully making the best first impression for them, they're going to go somewhere else. They're not going to get a good impression of the practice. And so I think it really, everything that we do, even case presentation, it all starts with the phones, right? Because if we can't even do the very basic answering of the phone and being polite with people, how are we going to present a $40,000 case to them, right? Like, it's like, oh, we're trying to, we're learning all these technical skills for presenting treatment. It's like, great. Can you answer the phone and schedule an appointment and have them show up? Like, if you can't do that, you don't have patience. So
It's true.
that's why, to me, it's so personal. And we saw it with your dad's practice, my father-in-law, in that, you did all the marketing. You were on the first page of everything. And, we had all these different savvy tricks and techniques, and people were inquiring about appointments. There were tons of people that were calling and texting and emailing to make an appointment. And he had the technology in the practice and all of these clinical accolades. But what was missing? They weren't converting those callers to appointments. And so that's really, like, no matter what industry you're in, you could be in the food industry, you could be in the anything, any industry, you could be construction. It's like, no matter where I call a place, you can tell if it's going to be a good experience right from the start when you talk to somebody on the phone. So
That makes sense. And what are you hearing from doctors you speak to regarding this issue?
there's a lot of frustration, especially now, because I feel like they have, there's one of two things. They either have a new team member or several new team members, because, yeah, as we know, there's a lot of turnover right now, which is why we have the all-star hiring service. A lot of dentists come to us for help with hiring, for, not just hiring, but hiring really good quality superstar team members. It's a little plug for the hiring service. But also, they have new team members, and the team members don't know how to answer the phone. And that the first thing that they say to me when they call me, these dentists, is, I have these new people. They're really nice. They're sweet people, but I cringe when I walk by and I hear what they're saying. And we've gone over these things again and again. I've tried coaching them and it's just not good. So that's the first scenario is new team members and just trying to get everybody on a consistent page. So, you have new people, you have existing people, and making sure that they're all communicating properly, especially with the phones. And then you have existing team members that dentists have frustrations with, where you have people that have maybe been there for a really long time and are very, very set in their ways of doing things. And they're not open to necessarily changing the way that they say things or do things. And with all the competition and all the different dental practices and practices that are doing training, it's important to make sure that we're always working on ourselves. I mean, even me, I'm the phone skills instructor. I'm still always getting coached. We're always learning. It's like exercise. If you don't keep doing it, you're going to lose it eventually. You have to continuously train. Even if you have people that have been there for a long time and that have had training, they're most likely reverting back to their old habits and ways of doing things. So the existing people need the training just as much as the new people. And then, like I said, bringing those two groups together so that the existing people and the new people are on the same wavelength. That's probably the number one reason that when I talk to dentists, they're looking for training or coaching is for those reasons.
That makes a lot of sense.
Mhm.
So, okay, so phones are critical, and
Mhm.
do you think that most understand the urgency? I mean, the doctors you're speaking about, they're saying to you, I'm hearing this is a problem. Do you think that most dentists and dental offices understand this urgency? And if not, why?
Some do. I think especially the ones that are listening to the call recordings, like if you have call recording, I recommend listening to it. It's going to be eye-opening. A lot of dentists have call recording, but they choose not to listen to it because they don't want to hear it. They're afraid because they know what when they listen to it, they're not going to be happy with it. So it's almost like ignorance is bliss and they just kind of ignore it, or they don't really know what the team should be saying. And so yeah, there's different aspects there. Repeat the question again.
Well, I was saying that when do most dentists understand the urgency or that there's an issue? And I think you're mentioning that if they're not listening to the phone call,
Yes.
that they're not going to know. So I think
Mhm.
that tells us a lot. And we recommend when those use our program, our training,
Mhm.
that we include call grading. We do a real call grade every month. With others out there, they do mystery calls. We don't believe in mystery calls because they can be
Right.
manipulated. We want a real call. And we
Mhm.
grade it in a service based philosophy, giving more points to did you follow a step that not just converts them, but sets them up for the future
Mhm.
quality. We don't want to manipulate. I mean, you
Right.
can do that, but you pay for the long run. But I would recommend that practices nowadays is so easy. Your marketing company will do call recording.
Mm.
Your Weave or other integrative softwares or voice over IP will do recording. It's like paperless office is like an old topic. Like now everybody's doing this. So
Mm.
most people have access to call recording. And if you don't find out, it's not usually expensive to do. We offer even portable options for our clients.
Mm.
So I think that's a great point, Heather. For those that are all-star clients, listen to your calls. We're doing it. We're working with you. But those who are not, start that. Start listening
Mm.
and evaluate. And I'll put a link to our webinar that I do, allstardentalacademy.com/webinar. And I talk about phone skills there. That's all of your material that you let
Mhm.
me talk about. And
Mhm.
in one of the bonuses, I'm kind of giving it away, but we actually
Mhm.
give you our call grading cheat sheet. So that what's great, go to the webinar, then you can get the link to get the resources, whether you sign up or not for All Star. But
Mhm.
what's nice is you can use that great call process that you teach in the grading sheet or the cheat sheet, and then listen to your phone call and see, based on what I taught you in the webinar, based on the cheat sheet, how are you doing? How are you performing?
Right.
And if you're not performing really well, we should have a conversation about
Mhm.
providing you some of the training and support to be able to do that. Because that's where it all
Mm.
begins is the phone. And I think that so that makes a really good point, Heather. Step
Mhm.
one, do we even know we have a problem? And
Right.
and so we could talk about it, but listen, and not just listen, because you can hear people that sound nice, but
Yeah.
nice is it's better than not nice, but they have to have a process
Right.
that leads to something. Otherwise, it's funny as we
Mhm.
call customer service companies, we're like, oh, you didn't even ask my number, you asked my name, you didn't do it. You know, you're nice, but I don't
Right.
feel relationship with you.
Right, it's like they do one or the other. It's like they're really nice, but there's no objective to get the
Correct.
person scheduled. So they're like, "Oh, this team member is really nice," but they never, like, ask for the appointment, or they don't, they just answer the questions and then the call ends, or they're rude. So I feel like they're kind of hovering between these 2 extremes where it doesn't have to be one or the other. It can be you're nice and you're helpful with the objective of getting the person booked for an appointment.
Hmm.
And I think dentists, it's funny, when I talk to dentists, they have excellent verbiage a
Yeah.
lot of times. Like, I always tell the dentist, like, you recognize you probably have some of the best verbiage that I've heard. And if you were answering your phone, you would know what to say and what to do.
Well, that said, however, once
Mhm.
you're on a call and you're like, "Go," well,
Yeah, that's true.
so we have to
That's
be
true.
careful. But
That's true.
doctors, they're used to studying. They absorb information really well, so they learn
Right.
because what we're teaching is not new. We borrow
Hmm.
it from some of the best companies of the Fortune 500. I don't think people know your story. You
Right.
were in Bloomingdale's as a trainer, sales manager, and you worked for my father's practice, and we helped turn that practice around from near
Mhm.
bankruptcy to 2.4 million, more than doubling in 18 months. But anyways,
Right.
with that is your history. You've seen how to do it right, and we use some of that technology in what we
Mhm.
teach.
Right.
So doctors have seen it at some point because they love learning and they
Right.
absorbed it. And they're like, and many of our members say, I would build it just like how you did. I love it that
Mhm.
you did it for me because I needed that. I don't have time to
Right.
build it. I don't have time to do all the training. You provided that support. It resonates with them. So that's
Yes.
why they're absorbing it. But then you have
Mm.
to understand it, absorb it, but then it's application.
Right.
How do we actually perform? And then
Mhm.
also what you'll talk about too in a moment is this can be
Mhm.
applied to any position in the office. If you can learn
Right.
phone skills, our program is we don't design it per position. And you might say, well, why? I want per position. Because if you design it per position, then it's like, this isn't my job. This isn't my job.
Mhm.
We build All Star as skill sets. And
Mhm.
phone skills are the basis of everything you do. And if you never answer the phone, having the phone skills training will help you with every other thing that you do.
Mm. Absolutely. Because the great call process, and, Shelly will probably elaborate on this with you in another
Sure. Talk. Yep.
podcast or video, but GREAT is an acronym for greeting, rapport, engage, ask for the appointment, and take information or thank. So even if we're never answering the phone, we're going to greet the person when they come
Right.
into the office. Of course, the first thing we do, we're going to build rapport if we're
Well,
doing
I'll
things
ask
the
you
right
this
way.
way. Let me ask you this way.
Yes.
So when they come in, do we greet them?
Yes.
Does the hygienist greet them? Does the
Absolutely.
assistant greet them?
Yes.
Does the doctor greet them?
Yes.
So we have greeting
If
going
we're
on.
if we're doing things the right way, like
Well, just
when
sit
you
in the
have an
chair. You still have to say hello. So I'm
well, so
saying,
like if they're, let's say you go into a practice, there are some
hmm,
practices where, you're only being greeted by the person that you're working with. But like in my dental practice, for example, every single person I walk by says hi and greets me. They're like, "Oh, hey Heather, how
right.
are you?" So that's
And,
what we're looking for.
and there is going to be some sort of a greeting, but you go into details of what has to happen. And then
Correct.
the biggest step is the R rapport in the great call
Yes.
process. And
Yes.
now, uh, not everybody does this. Not everybody builds rapport, but we
Right.
should.
Yes.
Every position is a step of building rapport. Actually, it all starts with your marketing
Mhm.
and your marketing, internal, external marketing, your brand, what it stands for.
Yes.
And then the phones is where it shifts from the external into the internal, where now you're bringing us into the family. And we have to
Mhm.
be amazing on the phone, but then each step in the process, it's verification. And if you
Right.
break any chain in the process, I think we have just like deer, we're programmed to like find anything does not match, we're out of here. So if we're coming through and we're like, and somebody messes up the process, we're gone,
Right.
or it's not a great experience. So every step of the process, we have to build rapport, and we can spend hours on that. And we
Oh,
spend a
well,
lot of
yeah.
time on the program.
Just adding to that, I talked to a practice the other day and they had concerns. They were like, well, if somebody calls up and they ask a question, to have to go through this whole rapport thing to get to know
Mm-hmm.
them and then to have them find out we don't take their insurance, that's just wasting our time. So I don't know about that. And I said, it takes getting to know the person and understanding their needs, their wants, what they didn't like about their last dentist, what they're looking for in a new dentist to really properly answer their question and to put it in the proper context. And so if they call up and say, "Do you take my insurance?" and you're like, "Yes, we do," or "No, we don't," there's no rapport. They don't like you, they don't know you, and they're just going to commoditize you. They're comparing you
That's right.
to all the other people that they talked to that gave a higher or lower price, or yes, we take your insurance or no, versus like getting to know you as a person. You're going to become a part of our practice. We want to make sure it's a good fit. And a lot of times when I had patients that had an insurance they wanted to use or were set on a certain price and we weren't that price, we were higher than that. After getting to know them, they were like, "Oh, well, you don't take my insurance, but I really like your practice and I want to come there anyway."
That's
So,
true.
this is why I teach people that because we do insurance freedom as part of our
Well,
coaching
kind of
process.
add to that with insurance freedom,
Mhm.
Heather, many times we can accept out of network. And that
Right.
takes a level. Now, let me tell you for those who are listening, because I know insurance
Mhm.
freedom is very popular. And whenever we do insurance freedom, be very mindful of this and be clear.
Very cutesy, very
Well,
mindful.
very mindful. Very, that's a whole other thing. Very demure, you said, right?
Yes.
So what is it? How does it go?
I don't know,
You don't
very
want to say it?
cutesy, very mindful, very demure. When we answer the phone, we listen, we pay attention, we're respectful, we're very mindful, we're very demure.
That's going to be a
I don't know,
short. I'm pulling that out as a short.
I just made it.
I love it. I love it. That's going to be great. So with okay, with you got me. You broke my state.
I know I
I was
confused
talking about
you.
we were talking about insurance freedom and then every step of
Yes,
the process. So with insurance freedom, we help people get off insurance.
yes,
We work with practices
with
on or off
coaching.
insurance with
Yeah,
coaching. Now, regardless of whether you're getting off insurance or not, all of our coaching focuses on insulators. We call it self-funding coaching because our coaching pays for itself within 90 days. Now, those insulators are critical, and that's the phone skills, broken appointments, and so on. You cannot, especially with insurance, you have to be on your game because they're not looking, people don't want to waste their time. And so we have to be mindful in that conversation
right,
to see. And in many cases, like you said, we can get out of network people to come, but we have to build a relationship. We have to take ourselves away from being a commodity, and
right.
that's where the rapport aspect of R is so important. So that rapport basically is and like and trust somebody, and the more you can, if you don't build that, and here's the other thing, it doesn't mean that building rapport has to take a long time. We
No.
don't create limits on the phone. We're not a call center. We're not pushing low quality. If you're just selling products and there's no
Mhm.
rapport, you don't care, and it's
Yeah,
super volume, we're not for you. You can still be quasi volume, but if you want to be quality and service, that's for what we teach. That's what we promote.
right. Well,
And,
it's
and
just
that's
like you.
and that said, though, last point, even
Yeah.
Walmart, they work on their customer service and their low price. So
Mhm.
service always wins.
Right. If you think about like the places that you really like going or the people that you really like doing business with, most of the time, the people that you do business with are the people that you like, that you have a rapport with. I mean, most people don't go to their hair salon if they hate the person. They like them, they chat. It's the same thing. It's like comparing like Burger King to Chick-fil-A, right? Like you go to Burger King, you're lucky if the lights are turned on and if you get your order.
That's true.
But you go to Chick-fil-A and they're like jumping out of the bushes, like there's like somebody between the window and the car to like hand you your food, like that extra step so you don't have to like reach out the window too far. Like they get it. They, my pleasure, they treat you well. So if somebody is coming to a dental office, which is already, a nerve-wracking experience for a lot of people, and you can make them feel like they can trust you and they respect you and they like you, you're going to have a patient for life. You're not going to
Sure.
have to worry about them going somewhere else. Whether you take the insurance or not, it's like if you choose to go out of network eventually, I always say that you have to have a good relationship with your patients and you have to know how to communicate with new potential patients to, like you said, build rapport and to be able to express the value of, hey, I heard all the things that you said and that are important to you. Here's how our office fulfills those things. You have to be able to match that. And like Eric, our president of coaching, always says, it's all about relationships. Everything that you do, it's about relationships that, likability, trust, likability, all of it. So,
Okay, so every position is rapport,
yeah,
hygiene, assisting, and you want to build more and more rapport. They like you, trust you, respect you. We move along, and that helps case acceptance.
yeah.
Then it's engaging the patient. It's
Hmm.
answering their common questions and concerns. And that often will either come up too early or too late and it's not dealt with. But ideally, just kind of running through the great call process briefly is every position, hygienist is going to ask the same concern that, or the patient's going to ask the hygienist, ask the assistant, the front office, and the doctor multiple times because they want reassurance. And we have to be able to overcome their objection or their question or their concern and be prepared for that. And we're all
Right,
saying the same thing. If we
right.
all say something different, like you had an assistant answer the phone at my father's practice once, and she
Hmm.
wasn't trained to do that. And very nice, but she gave a whole dissertation about what's
Yeah.
going to happen to your teeth and gums and how everything's going to fall
No,
out and
she had
every
she had her
specific.
she had her clinical assistant hat on, like,
Yeah, it
not
was too
literally.
much.
And
Yeah.
she was going into details about the implant process and all the surgical, and it was like TMI. They didn't want all that, and she literally scared them away. And I'm like, you can't say all that. Like, just we're gonna take care of you. We're gonna, you're gonna be comfortable here, happy. Like, don't go into all of that
It would have
clinical
been
stuff.
nice. It would have been nice if we had All-Star back then to give to
Yeah.
her to train.
Yes.
Well, and I think that's an interesting point to bring that up because that was before we developed All-Star.
Right.
But a doctor would say, why would I have my clinical assistant do phone skills training or even your All-Star program? That's for front office, right? No. As I'm explaining, this is a skill set that builds every area as you go. And you
Right.
look at like the Olympics, we had synchronized swimming. We all have to be synchronized, otherwise it looks
Yes.
silly. And I don't think
Yes.
we are. And everybody's got to have a similar answer and similar verbiage when it comes
Right.
to an objection. I'm
Mm.
scared of something. I'm concerned about the price.
Mhm.
Not, oh, I don't know. At least say something as much as you can and then find the person that can answer, but it's reassuring them. So we have to engage there appropriately.
Mhm.
And then
Right.
ask them for the appointment and taking information is we have to have an objective of what we're doing. It's team case
Mhm.
acceptance. We have a whole 1 day program that we teach every year or multiple times, depending around the country. We're having one in
Right.
Austin on team case acceptance. The entire team is in the process and they all have to know what goes on. So you can use great. Great is a foundation for everything that we do. And then we
Mhm.
build on with the patient experience, case acceptance and scheduling and so on. But
Right.
that's a foundation. So I mean, I know you rally or
Mhm.
scream across the mountaintops that everybody needs to be doing this type of training.
Well, yeah, because it, like you said, doctors tell me consistently that one of the biggest things they're looking for is consistency with respect to communication amongst the team. And so it's almost like we're running a relay. The person on the phone is the person going first, right? Like they have to start and then they have to pass the baton to the next person. But if they don't get a start, if they fall over, nobody else is going. So we have to be the one to carry the baton first. And then when I would have the conversations with patients, and I'd take all my really great notes and get them scheduled. We'd review all that information before the appointment, so we were prepared with the whole team. And then I would actually be the one to do the preclinical interview with the person when they'd come in, show them a little office tour. And then when I would pass the baton to the assistant or hygienist or, my father in law, they knew exactly who the patient was, what their concerns were, what they were interested in. Don't talk to them about this. This is what, sometimes even knowing how much they had allocated or budgeted towards their dental treatment. So people on the phones can make a big impact, qualifying, pre qualifying patients. There's a lot that goes into it. But you're right. Like if we don't start things off and then have it consistently throughout the team, I could have put on this great presentation over the phone and whatever. They come into the office and the rest of the team isn't trained on the same communication and verbiage. You're going to lose trust really fast. That's one of the number one things I see in reviews, negative reviews of offices online on Google reviews is like, and I've done this myself. The doctor was great. The person who was on the phone was great, but they just don't have their stuff organized. They're all over the place. Communication is off, timing is off, whatever it is. So that's consistency and
Every
training is.
every step of the chain has to be shored up. So that's really helpful, Heather. I mean, just kind of in review, what we spoke about
Yeah.
is phone skills are critical, and we may not even know. I consider it one of our silent killers. I talk about that in the webinar. And as I mentioned, that would be something great for you if you haven't seen it already, or if you want to see it again, allstardentalacademy.com/webinar. And one of the silent killers is phone call conversion and really being aware of it. And I like that idea that All-Star members, listen to your phone calls. All-Star non-members, listen to your phone calls. And also in the webinar, download or access that grading cheat sheet so you can see, are we doing GREAT in the process? No matter how
Mm-hmm.
nice we are, if we're not hitting those objectives, our conversion is not going to be ideal. Customer service is not going to be ideal. And then the second part of the conversation was that GREAT applies to every position in the office. You can apply it, and everybody should be doing phone training or the skill sets of phone
Right.
training, because
Yes.
that sets everything else up versus having to be repetitive. Everybody's got to be on the same page. Is that right? I see you smiling, phone skills instructor. Like, that's correct. I've been wanting to make sure that people hear it. They got to hear it again and
Yes.
again. Cool.
I know that's my big thing that I stand up on my podium or
Yes.
and shout it from the rooftops just because I feel so passionate about it. And I've seen offices where they do training and then they get to a certain really high level and then they're like, "Oh, we're good." And then they stop
They
and it's
lose
like
it.
now the person it's like, "Can you work out for, once a month and stay in shape?" No. Like highly
You
unlikely.
got to
You have to.
keep doing it. You got to keep doing it and
Yeah.
doing it and sticking to it, making it automatic, building that habit. And that's part of the community of All-Star Dental Academy. We continue to do the
Yeah.
podcasts, our coaching, our events,
Always be training.
always be training, ABT.
Yes.
Thank you,
Yes.
Heather Nottingham, for
Thank
being on
you.
the program. And for those who are listening, make sure to like, comment, share with your friends. And until next time, go out there and be
And be
an
an
all-star.
all-star. Woo!
Woo!
Yay.
Bye.